Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractor. Let's talk about cat-cow move and how you can do it incorrectly and how to improve it so you do it correctly. This video has to do with spinal cord flossing. What the heck is that? Stay tuned. Spinal cord flossing. Flossing of the nerve is a pretty popular thing these days. A lot of people, at least I hear a lot of people talk about it. Many people don't even know what the heck that means or are doing it incorrectly. Just like with any nerve, you can floss it, which is just like any soft tissue. You know how you can stretch your muscles. You can actually go from a shortened state to a lengthened state. You can do the same thing with any soft tissue, and your nerves are soft tissue, so is your spinal cord. So throughout the day you're sitting, there's a lot of compression of your nerves depending on what it is you do. In this case, since this video has to do with spinal cord and your spine in general, we want to floss the cord. And what you want to do is you want to put it in a state of contraction versus elongation. So one of the things that we do in yoga has to do with cat-cow moves, which is ideal. It's perfect if you don't have the lifestyle we have in this country or industrialized nations where we sit behind the desk all day long. So you can actually over-accentuate the moves, especially when you go into lordosis, when there is too much of the cow pose, and you can actually cause what's called facet disorder, meaning you're just pushing your spine, your vertebrae into each other too much. So don't over exaggerate. And what I want to show you is a variation of that, and also how to do it correctly and how you need to actually break it down to the lower back and the upper back area to isolate those more so than the other parts of the spine as you're proceeding. How often do you do this? Every day, couple times a day. So first thing in the morning, last thing you do before you go to bed. The type of stretchings I do on a daily basis before I go to bed and after I wake up, it typically takes me about 5 minutes, and then I do other stuff, which we won't bore you with.
And this is something that's for everyone?
That's for everyone, really. Even people with fusion of their spine. That's a very good point. With the fusion of the spine, if you experience pain, stop. Check with your chiropractor. You can email me if you want, and we'll see what's going on. You should never ever go with the concept of no pain, no gain. That's all bullshit. So go to the all four pose. Scoot back a little bit so we can see in the camera. That's perfect. So in a normal situation, your hip needs to be right above your knee. Your shoulder joint needs to be right above your wrist. A lot of times people have wrist issues. They don't have as much mobility, in which case you can be behind your wrist and then readjust your knees so your knees are right below your hip joint. In this situation, the best thing to do, and this is some of the functional kinesiology, functional movement and kinesiology and touch, is you want to make sure that your barrel is engaged. So I'm going to make sure that I put a video that explains what the heck barrel is. So you go ahead and engage your barrel, push my fingers out. You want to bring your scapula down and bring your spine in the lumbar spine more into a flat. So what we want to see is more of a flat spine. Your neck is along the rest of the spine. So this is a good pose to hold for a few seconds before you go through the flexion extension of the lumbar, and then we'll switch it to the mid back. So what you want to do is you want to go push your spine in this area from the diaphragm down as much as you can, which is at some point going to engage some of the upper back. Go ahead and push it up towards the ceiling all the way. So this is really a movement of the pelvis, not so much here. It's a movement of the pelvis, and you go tuck under and you kind of flex your pelvis that way and try to create the movement in the lower back area. And then when it's time to let go, you just go into the other extreme. Go all the way. You don't want to be doing that. I see that all the time. That causes really issues. It compresses your facets, which is not a good thing to do. So don't go so far down. Just go up and control movement. When you're at the cow pose, you're not really letting the gravity pull everything down. You do need to control the movement in the downward and in the upward position. When it comes to the mid back, go into the neutral again. Thanks. Bring your arms back and bring them back, actually, instead of it being right below your shoulders, go back a little bit to give yourself more leverage. Try to maintain this into a neutral and push this part of your mid back up, just like that. So you see there is more of a curvature here. The rest of your neck is not looking up. Your neck is down here along the spine. And then go ahead and drop that down. You keep this area neutral and drop this down. And as you're doing it, you bring your neck up here. So let's go ahead and do the cat and then drop it. Very good. You can go ahead and sit down. So thanks. So in this pose, you're actually not so much compressing, but you're letting your spinal cord come to the two ends, come together more, and then stretch more. This is just like stretching your leg muscles, your arm muscles, your neck, whatever the case may be. You're stretching the soft tissue and you're letting it go through the movement of contraction and letting go. Contraction and letting go, which is a normal function of that soft tissue. Remember, everything you do throughout the day adds or takes away from your health. So design it so that adds to your health in a positive way is more than the opposite. You are the designer and the director of your own life, so design and direct it the way you wish to live it. If you have any questions, go ahead and shoot me an email or contact me through one of the methods of contact we'll put in the description box, or just go ahead and comment below and I'll make sure to answer it. Thank you for watching. Make sure you subscribe and also share this video. I have a podcast now that you can find me on Apple and Google Podcasts as well as Spotify. The podcast is called Life and Health Matters with Dr. Shakib. We'll make sure we'll add that to the description box as well. Thanks for watching. Take care.